السلام عليكم ورحمة الله. مرحبا بكم جديدا في محاضرة جديدة من سلسلة محاضراتنا مراجعة أسئلة اختبارات البرومترك Review of Barometric Test Question. This is lecture number 3 in medication and number 20 in Ghaith review. Today we are going to discuss 5 questions from question number 116 up to question number 120. معكم محمد عثمان يحيى. نبدأ مباشرة. Question number 116. 13-year-old patient is admitted for diarrhea and vomiting. He looks pale and lethargic. A nurse is preparing to give IV hypotonic solution. Blood pressure is 110/70. Heart rate is 76. Respiratory rate is 18 per minute. Temperature is 36.1. Which IV solution is most appropriate? The options are number A, 0.9% saline, number B, lactate ringers, number C, 10% dextrose in water, number D, 0.45% sodium chloride. وقف الفيديو هنا واختار الخيار تشوفوا الصحيح. The correct option is option number D, 0.45% sodium chloride. لأخذنا الخيار راح نبتدي نشوف Rationale. 0.45% sodium chloride is hypotonic solution because it has a concentration of dissolved particles lower compared to plasma. So the correct option is option number D. Option number A and B, 0.9% saline and lactate ringers, are isotonic solution. And option number C, 10% dextrose in water, is hypertonic solution. Question number 117. A nurse is assigned to care for a group of patients in the medical ward. The nurse reviews the client's record and determines that what patient is at risk for excess fluid volume. The options are number A, patient with ileostomy, number B, patient taking a loop diuretic, number C, patient with chronic renal failure, number D, patient hooked to gastrointestinal section. وقف الفيديو هنا واختار الخيار الشخصي. The correct option is option number C, patient with chronic renal failure. ليختم الخيار رقم C نشوف Rationale. A fluid volume excess is also known as overhydration or fluid overload and occurs when fluid intake or fluid retention exceeds the fluid needs of the body. The causes of fluid volume excess include decreased kidney function, heart failure, use of hypertonic fluids to replace isotonic fluid losses, excessive irrigation of wounds and body cavities, and excessive ingestion of sodium. So the correct option is option number C, which is the client with kidney disease. The client taking diuretic, and the client with an ileostomy, and the client who requires gastrointestinal section are at risk for fluid volume deficit. Question number 118. Physician orders an intravenous fluid of D5NS at 100 cc per hour. This is an example of which of the following intravenous solution. The options are number A, hyperalimentation, number B, hypertonic, number C, hypotonic, number D, isotonic. وقف الفيديو هنا واختار الخيار اللي تشوفه صحيح. The correct option is option number B, hypertonic. لاخترنا الخيار رقم B نشوف Rationale. D5NS is a hypertonic solution because it has higher concentration of electrolytes than plasma. Common examples of hypertonic solution are D5 in 0.9% normal saline and D5 in lactate. So the correct option is option number B, hypertonic. Question number 119. When a patient was first diagnosed with schizophrenia, one of his family members asked the nurse about the possible causes. The nurse said that one reason is that he may have had an excess secretion of which of the following neurotransmitters. The options are number A, serotonin, number B, dopamine, number C, glutamate. وقف الفيديو هنا واختار الخيار الشمسي. The correct option is option number B, dopamine. اللي اخترنا الخيار رقم B نشوف rationale. Neurotransmitters are chemicals that carry message between brain cells. Many studies have investigated the possible role of brain neurotransmitter in the development of schizophrenia. Most of these studies have focused on the neurotransmitter called dopamine. The dopamine theory of schizophrenia states that schizophrenia is caused by an overactive dopamine system in the brain. There is strong evidence that supports the dopamine theory, but there are also some data that do not support it. So the correct option is option number B, which is dopamine. Question number 120. The nurse administered a dose of morphine sulfate as prescribed to a patient who is in the post-anesthesia care unit. The patient appears to be resting comfortably. The respiratory rate is 8 and the oxygen saturation on 12 liters of oxygen via nasal cannula is 86%. The nurse should immediately administer. The options are number A, flumazenil, number B, midazolam, number C, Naloxone, number D, ondansetron. وقف الفيديو هنا واختار الخيار الشمسي. The correct option is option number C, Naloxone. اللي اخترنا الخيار رقم C شوف راشد. Naloxone is a medication or is a medicine that rapidly reverses an opioid overdose. It is an opioid antagonist. Naloxone can quickly restore normal breathing to a person if their breathing has slowed or stopped because of an opioid overdose. Examples of opioids include heroin, fentanyl, oxycodone, hydrocodone, codeine, and morphine. So the correct option is option number C, Naloxone. Flumazenil, it acts as both an antagonist and antidote to benzodiazepine. And midazolam is a benzodiazepine medication used for anesthesia. And ondansetron is a medication used to prevent nausea and vomiting caused by cancer chemotherapy. شكرا جزيلا، نتقابل في محاضرة جاية. Don't forget to support us by comment, like or subscribe.